those pop. Alrighty, who's gonna start the treatment? You wanna do it? Okay. All right, let's get the gel on her. There's a clean brush. I'm gonna throw this one away.
Do you have a headband for her hair?
Which is what? The Pluna?
Probably not.
Details to the customer. Into the offices, they're 1,000. If they buy more than 5, it goes down to 900. More than 10, they, yeah. And the consumable details.
I think, yeah.
That's the gel. We also have the spray gel.
I think the other girl had her own hair headband.
Lay down?
Yeah.
Okay. Then maybe later.
I'm okay with it. A little bit of gel.
Cleansing the skin.
I think she
Yeah, I
did it
did.
already with
Uh-huh.
makeup
Yeah,
wipes.
cleaned it.
I don't want you to dry so fast. So I'm like, do I do it now?
Here she comes.
Yeah.
Okay, here we go.
You're just gonna paint her like you're an artist. And this is your canvas. Because she has such intense melasma, we're gonna do a combined treatment. And I'm gonna treat her with Orion after you finish this.
Oh, wow. Okay.
The neck would be done completely separate. You wouldn't do it as
We're
you
doing
do
neck
this.
too?
You can if you wish. If she wants her neck done, you can do both. I prefer we stick to the faces now and do a neck separate, so I
Okay.
can do a neck start to finish.
Okay.
So would you treat it higher energy where you don't have the melasma and then lower
Yes.
over the melasma?
Yep.
And if she's a higher fits, what would you start with if you're doing the Neola?
Fits is not
It
a
doesn't matter.
consideration
Because of the gel?
because of the gel. I can treat her at the same intensity I just treated Nancy.
Did you hear that, Denise?
Yes, but
have a
it's
lot
different
of-
series, right? So it would be like like a series of three?
A series of 30?
Three. For like a...
No, this
Oh,
is
it's
one and
not?
done.
Oh, okay.
But with the gel, she's saying, so at our regular
It's
training,
relevant.
we had I have a lot of Hispanic and Middle Eastern clients, so a
That's
lot
why
of
this
our
is so
patients
perfect.
were low energy.
Yes.
And, you know, it was like they saw some results, but it wasn't like, wow.
Yeah.
And it's just, I guess this is kind of that.
The thing with Neolift that I love is everyone's skin is the same. So your color becomes irrelevant. The only thing that matters is getting enough energy to cause the change that you want.
That's interesting. I would have thought like you thought, like still lower energy to start with the gel.
Yeah, that's what I would have thought.
You're just
it's
looking for that
colorblind
clinical
because of the gel.
The gel.
Were you hitting all your plants
A couple of hers, she had some darker fits, Hispanic patients.
You get
Not
gel
intentional.
down here so
All
she
the
can
people
get
that I brought
those.
were like type 2, maybe a type
snake
3,
bite.
and I was just like, we were just
What was that?
lighting them
I
up.
said
And
just
they
so we
had
can get the
amazing
wrinkles around her
results.
ear, yeah.
What? At what?
1.2, 1.4.
Okay, okay. That's where I am too. That's why I was like, what are we doing?
And then, like, you know, they're sending me the pictures. And like, we were talking about this morning. So, like, dry 1 to
Yeah, what you
1.4.
learned in the beginning, I wanted
They
to
look
learn
better,
again
yeah.
because
And
of that.
then, like,
I know, it's like
they're
different
so later, they
technique.
look better, and then they
Yeah.
look worse.
Yeah,
again.
yeah. I sat for a vegan one day. I was like,
I'm like, oh my gosh.
she looked really bad. I was like,
And it gets much better.
And then Ashley was like, when I came out of church, like, it's fine, it's fine. I saw this from BBL. I would have fried that. I'm like, are you sure this is okay? And then both of the patients, they were joking about how their skin was peeling. And the one, she's one of my best friends since kindergarten. Her son told her she looked like a zombie because pieces of her face were on her shirt. So at the end of it, when everything looked good, I asked both of them, was it worth the downtime? And they were both like 1,000%. Like my skin looks so good already. That, and I was
It's
like,
always
okay,
worth
because it was stressful for me to see these pictures coming in. I was like,
Managing,
about the gel in my
babysitting the
hair.
healing phase of Neogen is one of the reasons I
Oh, it's okay. Yeah,
Because
that's
I supervise
I'll be cautious.
1,000 treatments a week across the United States. Everyone sends me their befores, their afters, their settings. So I was supervising every healing, thing you can think of. And overall, I kept coming back to nobody wants to live through day 5. Day 4, really ugly on day 4. Nobody's happy. So if we can avoid that, why wouldn't we?
and then I think the ability to treat at a higher energy because that's what the patient needs, regardless of their skin type is.
It's huge.
Yeah.
It is. Okay, so in order to find her optimal setting, well, we're going to wait and let that gel sit for 10 minutes so she's hydrated. And then we're going to find an area of real soft skin. So like here where you can visualize, or here where you can visualize, because you've got to be able to see that skin sink in. So we never do that on a bony prominence because you won't be able to see the contraction. So you find a broad, soft spot, and that's where you stay. And do the test. And you'll see the skin. We'll try her at like 1/8, and you may not see anything, and then you'll turn it up again and turn it up again. And when you find the right setting, that skin responds almost like saran wrap.
Okay. Like a snap?
Like a
pullback?
like a pullback, yeah, like a shrinking. And this is a perfect test case because she's got all of the things. She is a FITS 4, she's Asian, she's got melasma. I mean, this is your classic do not touch patient, right?
Yeah.
But you can do it with the lift.
Of course.
Yeah, that's what I want to do. What can I do with the lift now?
So take your brush and you want to feel that gel, make sure it's not getting too tacky.
So it still will help like her pigmentation. It's just not.
It helps pigmentation.
yeah.
It just doesn't peel
It's
away.
not main. Okay.
Yeah.
But it will
So
still
it
really
fades
target it.
over time, and it does lift with fading, but it's not that instant satisfaction of peeling that some people love. I never liked the feeling of peeling, but I have friends of mine that will still only do dry Neogen because they want.
Oh, no, none of our patients. Everybody's like, I don't want any downtime. So they got all excited when we got the device. And then I'm like, you have to wait until the end of May. We have to go to this advanced training. And they're like, okay, let me know when you're done. Because no one wants to peel.
Yeah, I think nowadays, like, people don't want
Especially
that.
not
Like,
this
even,
time
like,
of year.
VI peels, perfect dermal peels, like, everyone's kind of stepping away from that. Yeah.
Yeah, I don't. Our patients are very game. They don't want anybody to know they didn't know.
Yeah.
But that's me included.
Yeah.
I'm a freak about downtime. I'm in the house hiding from my husband. Like, oh, don't look at me.
I
And
just
he's like, you didn't like that.
Karen was a model from our last advanced training. I was just telling her how pretty she was. Her skin, I see a big difference.
So when you do the neo lift, is your downtime, like, or your recovery the same, like, 7 days? It doesn't matter. When can you?
24 hours, you're free.
Really? And you can't even go in a hot room?
In 24 hours. Not for the first 24 hours.
Yeah.
But after that,
7 days.
After 24 hours, they're okay to put makeup, wash their face.
Oh.
Okay, because we got.
I just don't want them scrubbing.
Okay,
That,
for a week.
yeah, I
7 to
still
10 days.
prefer them washed gently. But
Gently
they can
cleanser.
use a cleanser after 24 hours.
And it's okay to apply SPF after 24 hours?
Yes.
Okay.
I'll let her apply SPF today. Because I don't want her walking out in this weather without SPF. on.
Especially
Yeah, we're in the middle of the. For me, this is too hot. Like I'm ready to go up north again because it's too hot.
Yeah, it is hot here for the time of
Once
year.
once it
Feels like
gets to this
August.
hot, it's time to go. You know.
Yeah. That's interesting. I think Edwin sent me like needle lift pre and post.
Yeah.
And I think the downtime was different. Like don't wash
It
your
says
face
more.
for 4 days.
Yeah, it says more.
Okay,
Yeah.
so it's good
So
to know.
those are actually from my first advanced training of Neolift from 2 years ago.
Okay.
Thing is, the more I've taught, the more I've done, the more I realize you're basically free to go right after the treatment.
Okay,
But I
that's
don't
good
ever
to
tell
know.
anybody that.
Yeah.
Okay, that's good to know.
Because they do wild,
Well,
crazy
it's-
things.
yeah,
Yeah,
better
like
to
the
make them more
hot
cautious.
yoga
Yeah.
that same day. Yeah.
Oh, she said it's fine tomorrow. Like
Well,
it's fine
that's
today.
why I texted her, I'm like, can I go in a hot room? She's like, 7 days. I was like, oh.
Oh, that's funny.
Yeah.
Well, even like your technique is like so much more laid back. Like when I was doing it, I swear I spent 2.5 hours.
Oh
and
my
my
God,
whole
I know.
Yeah,
I
my
was
whole
like,
body
this
was
is
stiff.
going so fast. My hands started shaking.
I went to bed at like 8 o'clock. I was like,
forever.
I had so much coffee this morning because I was pouring and drinking. So I had real strong coffee this morning. I was like, oh, I'm going to be like this. That first set of eyes, I'm very worried.
You did great.
yeah, no, it was great.
No, that was like so
No, but
much
it just
fun.
looks like you can move so much faster with
You
it.
can.
Yeah.
Because you know you're not, there's a real comfort in knowing I'm not going to burn.
Yeah.
There is the real comfort in knowing they're not going to pull away because they're too hot. You know what I mean? Like,
Yeah.
they're much more relaxed, so I'm much more relaxed. You know that jumpy patient that's terrified?
Yeah.
Like me.
Yeah, you fire a couple times on them and they go, oh,
Even
that's
if I
it.
don't hurt, I'm gonna jump.
That's it. If it hurts, you're going to jump. Honey, do you
I'm
want
gonna
to
jump even if it doesn't hurt.
I vibrate. Energy touches me, and I'm like, oh, okay. I am the only one that can do my treatments. Everybody else turns me down.
I'm using nitrous oxide when I get anything done. I'm just
Oh,
like,
honey, you
horrible.
don't need it. You'll be able to do Neogen. But if I had it, I'd allow you to use it.
And I think when we did it, we did one section at a time because of the gel. Right?
Yeah.
Like we didn't do this. We kind of just like waited because we didn't want it to dry.
Go.
Okay.
can
That
always
ma-
add
okay. This
more.
is a lot more like relaxed, I feel like. Right?
Than you were
we
the
were so
first
tense.
time?
I feel like every muscle in my body was used when I was doing the first treatment.
Oh, same.
Well, and we were like so focused that we were like overlapping the
I wasn't breathing at one point.
pulses.
Yeah,
Yeah.
and then you see like sometimes like a white section, you're like, crap, did I miss that? Like, or is it the numbing?
Yeah, and that's the other thing. I don't like the blanching from the nose.
Yeah, because like you don't know if you skipped over it, so you maybe do another pass. Let's
And-
look for the bus.
And numbing works to a degree for heat, but let's be honest, it's not designed for heat.
Yeah.
You know what I mean? So even when you numb someone for 45 or 50 minutes,
You're only gonna get
at
so much.
1.4, they're going to,
Yeah.
you know?
And I never thought about like going back
That's what
and
your
like,
skin
having them
looks
sit
great.
up and
Thank
looking
you.
at your face. Like,
Yeah,
We're supposed to do that when drag people.
I thought that like if I did it like that, it would
She treated her mom. She was like,
You're ready to start.
ready to go.
I think I did one side
I
better
just
than
like
the
get
other.
2 people on my
So I should do
You should turn her down from 3.6 for sure.
to like
The safe spot to start, or the best place I think to start is like 1.8.
yeah.
Some people respond beautifully at 1.8. She may not, but it's a good starting tester spot. And how many shots? Okay, we got enough. Good.
Okay, so the
So
test.
treat and accept, just like on your machine.
I'm like nervous. No, I'm not. I'm fine.
You don't have to.
So to test, I'm
Yeah, just
choosing
find one of the
here.
soft spots where we'd be able to observe the contraction.
Oh, it's
Now treat again.
Treat again.
It was ready to go. You just weren't.
You're just eating.
You know why? Because on our other machine, when it says standby, it has to say ready for us to fire. I've done the same thing.
Okay.
That's why.
Yeah, she's warming up. She's slow today. She was out drinking.
I was gonna say, was she
till
drinking
1 in the
tequila
morning.
last night too?
Apparently she was. Come on, Mama.
Check it Sunday. I'm tired.
Yeah. Okay. You're gonna need to do like 4 pulses in a line. Do me a favor. Try right there.
Here?
Yep. Yeah, no, I'm not seeing it.
So what are you looking for?
I'm looking for that skin to contract. I'm looking for a visible pulling on that skin
And
So
you
you
have to do
keep
standby.
increasing it until you see that.
until you see it. Yep. And find an adjacent spot. I see a tiny bit, but not what I would love. I would try turning her up again.
Do you usually go up by 2s?
I do.
Okay.
Now try right there.
In here?
Yeah.
I kind of see.
I see a little.
I see a
Yeah, I do. 2-4. There you go.
2-4? Or
I'm
2-2?
sorry, 2-2.
Oh, okay.
But you can turn it to 2-4 if you want to. But I did see it at 2-2.
Should I turn her up?
Try her.
Yeah.
She wants a good result.
Yeah.
She wants a good result. She got 0.7 before.
But I would probably put more gel there, right?
Yeah, you're
It
gonna,
looks pretty dry.
you're gonna spread. Ah,
At least from this angle. I don't know.
beautiful. That's enough. You don't want to do too much.
Okay.
Yeah. First one goes out behind the ear. So you got to make sure you got gel back here. Basically, when we do these lines, the first one goes out behind the ear, the second one goes out and comes in front of the ear. So we're creating like a little C around that ear.
It's almost like a saddle.
Yes, exactly. To lift right there. Because if we don't tighten this junction, the jawline never looks tight.
Yeah, because that's what you're striving for. Is
Yeah.
that, so you're taking the pre-rip and post-rip. Okay.
Yes.
What is the French that you're talking about? This big snap?
Is this far underneath, like this
Yeah.
way? Okay.
Yes.
And it's okay
Further?
for that wide.
Is-
Right there. Yeah. I like it a little tighter, the jawline, but that's okay.
Higher.
So you're going to go back underneath and then come up periwinkle. Beautiful. Yes. Very nice. Do you see how nice and snatched that is?
Yeah.
Compared to the other side? That's beautiful. So
Yeah, you
now,
can tell the difference. Come over here. You can tell just the skin underneath the.
yeah.
Oh yeah.
Yeah.
It's
Yeah.
Look how high that is.
Yeah.
That side compared to here.
So now you can just start on the face. So we start, the face line starts right here, up and over to the ear. So you do this. Yep. Yes.
okay. So you're almost taking, you're doing almost like a sling. You're starting with the
Yes.
base and pulling it up. It's not
Yep.
like the old-fashioned toothache thing, you know.
Yes.
Yeah.
How old is our beautiful patient?
70.
Years young.
Yep.
This treatment is essentially
So go
for any
come
age.
from here. We always want to get that pre-gel sulcus kind of covered when we do this. So you're going to go up to the corner of the mouth, out to the tragus of the ear. Yeah. And then you're going to fill that box in. Vertical first, lateral second.
Ours always freezes on us.
Beautiful. So that's your outline for your coloring book. Now we're gonna color it in.
And you're saying
That's
And wrap- that's the wrapping.
That's the wrap. So we go up over the jawline with each one. Yes. Are you
I
gonna
have
do
a
this
lot of
sometime?
nerve
Yeah, I'll do this at 95.
Oh, okay. I don't have anyone that.
95 is the oldest I've worked on. I don't find that many in their 90s.
At
but
95, wow, having the ability to get a treatment.
My mom at 89's, her skin was tight as a drum because every 6 months, what time is my knee again? Is it time for my knee?
So would your would your treatment interval be closer together the older they
Yes,
are?
yeah.
Okay.
Because they can't, their collagen synthesis is much shorter. So I will do, at the older they get, I will bring them out. My mom, I was doing every
I was
4
wondering if you needed to go out a little further, more lateral.
So now,
Or did you already? Oh no, you did the lateral when you did the line. Okay.
I'm actually going there.
all right, and what,
So I did the wrapping.
yeah, so now you're gonna do the lateral. Same place, just laterally. Yeah, I had these made from my mom. They were originally 7. Sometimes we do 7. But I gave 2 of them to relatives. My mom's South Carolina. I haven't gotten there yet. But I will.
Yeah, they have the gold over there, which
Oh,
I'm planning to go to.
I'm down to
I've been to the one in Dubai, and they have the most
Was it amazing?
amazing jewelry. Oh my god.
I was offered to, someone wanted me to come and train them in Dubai, and they offered to pay for everything. But I'll take the time to go. So I'm hoping to get the name.
Yeah, I could definitely tell a difference.
There you go. Okay, now you're going to start that upper cheek section. What did you find?
Oh my god, since you're asking.
Yes.
I cut this,
So the difference you're seeing is the skin pulling in.
It's tightening, snatching back,
That's narrow.
going up the nasal and then out. That right? So
She needs the
so going up
Yeah,
here
you go up.
and then through the nose corner here.
So we're going to go right now from what you finished. You're going to put in your 2 Nike swooshes.
2 Nike swooshes. Okay.
One there, and then you're going to cover the eye with the spatula and work up to the orbit.
Okay. Got it.
yeah, I'll show it to you. So, this was back in 2017. Okay. Yes. No, actually, it was 2007. Sorry. Even cheaper. So I got those. I borrowed them.
Go and look up to the ceiling for me
25 grand.
with your eyes open.
Insane. I brought it.
Go ahead and close your eyes.
Got it now. Yes, and yes, I got it now, dude. And it came out to over 100 grand. And the viewer who was evaluating it and reviewing it was like, this is the biggest jewelry I've ever seen in my life. So like, really, I felt good about that. I'll pull up a picture.
Are you feeling okay?
Something weird too if I go to a wedding, you know?
Just like
Otherwise,
one
it's
sponge.
just too much.
It's a bit,
Yes, it
but it gives you a reason to relax.
is.
I had from my ancestors, on my mom's side, I had a 4-carat pigeon road really that was set in a very big cage setting. Wasn't that magnificent?
Now, do you do the same horizontal for that area?
Yes.
Hatch.
Go and look up to the ceiling for me. Go down, close your eyes.
Mr. Go.
No, the funny thing is, I always thought I was Lebanese. We always thought we were Lebanese. My mother was raised Lebanese, Lebanese food, Lebanese church, everything. Did 23andMe, found out there's no Lebanese in her. She's 100% American.
Oh my god.
And then we were able to find out the village that she came from, which is called Medellin. And we saw photographs of the people in the village, and my brother looks Turkish. He's got the nose, the whole, they all look exactly like him.
Oh wow.
People just randomly from there. So he wants to go. I said, we'll go this year. Let's plan a trip.
It's a beautiful country.
Yeah. I haven't been.
Very picturesque, actually.
So for upper eye, you turn it down.
Yeah. Jen, well, she may not need to, though. See how she does. Did you do the lowers yet?
Yeah, I went
Put it all the way
lateral.
here.
But you actually went into the lower eyelid? Well, on your
I-
lateral pass?
I went, I covered like that much. So I went underneath here.
Okay, because I'm just looking at that one line that I don't think you got.
Yeah.
So we're gonna have her open her eye and place the spatula there, and now hit that.
Okay. At 2.4
Yes,
laterally. Or
just straight across is fine. Good.
You okay?
Now you can do the upper. How you doing, honey?
I'm doing okay.
Okay.
At 2.4 still?
And here you don't do the upper eyelid, right?
You do.
Oh, you do?
You do.
But you-
But you go above the fold. So you
Yeah.
find her natural fold, which we can see the line. She's got a deep set eye. So close for me. So we're working above there.
Oh, that.
Yeah. You find their natural first fold and work above it.
like following it.
Yeah. So lateral,
Laterally?
lateral, and then you do the little verticals on the eyebrow bone.
Above.
Yeah. Good job. You didn't even hesitate. I love it. And you got a perfect model because she doesn't flinch. Good job.
Has someone already
Okay,
done
now,
this side?
now when you do the verticals, they're on the brow. You're covering the lash with the spatula and pulling the brow up. And now you're going from the fold to the spatula.
Okay.
And it should be about 3 pulses. Boom, boom, boom. Yeah. And move it on across. In her case, she needs 4 to get up to the brow bone. Nope. I want you to redo that line because you were too far apart.
away?
Yeah. Good. That's having command. But I want you to get up in there. See where the skin looks white because it never sees the light of day? That
Right
means it's
here?
like, yes, you want to get in there. There you go.
Ooh, I smell something burning.
The hair will still burn with this if you don't protect it. Good. Excellent. And now you can
Oh, I
move
can
on.
really see it lifted
can.
already. Wow.
You're doing a great job.
Thank you.
You're welcome.
And then
So now when you do the forehead, you're going to cover the brow again. Okay. So I always start with the lateral on the forehead because we got to cover the brow.
Is that true for all your passes? Do you tend to go lateral and then vertical?
No, but with the brow, with the hair, I like to get the line closest to the eyebrow out of the way.
Oh. So which way are you going?
So you don't have to work with the specialist
Let me go.
the whole time.
Are you going horizontal inside out?
Yep.
So up, then sideways. Starting.
Or sideways and then up. It doesn't matter as long
Okay.
as you're protecting the brow.
Should I start here?
You can, yeah.
Okay.
Make sure you got gel there. That's a very sensitive area.
Okay.
Yeah. The temple is possibly more sensitive than even the eyes.
It's so cool.
I wish I had a headband.
I know. I wish they had a headband too. I would have
Those
brought.
disposable ones would have
Yeah,
been
we
easy.
buy them from Amazon. I should have brought some with me. How does your skin feel? Did it not?
Good. I love it right here. And you're irritated. That's it. Everything else is fine. But it could be the jacket. So.
You don't look right.
That's what she said. She's like, I can't believe I but I didn't expect her to be
If she doesn't might not feel too bad. Oh, like a dead lobster
So I
gel.
had Morpheus done, one Morpheus done a couple years ago because I won it. And I was like,
I react horribly to everything.
Thank
But it goes
you.
away. But like if I touch my neck, it would be
Yeah,
like,
yeah, 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 yeah,
like I touched one of those.
Just a little forehead.
where are you all from?
Chicago.
Oh, you're,
Like a
okay,
Southwest.
you're in Oakland Park. I got right.
Yeah, southwest suburb.
Yeah, I used to live in Dearborn and Elm and Gold Coast area
Oh,
for
okay.
9 years. I ran the skincare and plastic surgery on my up top of where Michael Reese Bloomingdale's building. So we did. I used to run the whole plastic surgery thing scrub there. I ran the whole skincare and I inject and stuff like that. So it's fun.
Let me do her second half.
What was that?
I said I'd like to do the other half.
Yeah.
Very cool.
This thing over before I leave.
I know, I do it too.
How was doing the salsa one? Did you get tired?
Oh, sit up so we can see your face.
Oh.
Let's see.
You're basically just holding on to it.
Excuse me for just a second. Let me see.
Oh, that's